significant ST or T-wave changes on new left bundle branch block. Development of pathological QAs in the ECG, imaging evidence of new loss of viable myocardium or new regional wall motion abnormality, identification of an intracoronary thrombus by angiography or autopsy. The second criteria is cardiac death with symptoms suggestive of myocardial ischemia and presumed new ischemic ECG changes of new left bundle branch block. But death occurred before cardiac biomarkers were obtained or before cardiac biomarker values would be increased. And death during percutaneous intervention related to MI and coronary artery bypass grafting related MI. And this is the take-home message of my presentation. So please concentrate. How to differentiate a stable angina, unstable angina, STEMI and NSTEMI. It's important to diagnose what is the actual cause in that patient because treatment varies and management differs. In stable angina, character of pain occurs during exertion. And in the unstable angina, rest of the three, pain may be during exertion or maybe during rest. Relievers. Stable angina relieves with the usage of vasodilators like glycerol trinitrate, and in unstable STEMI and NSTEMI there may be effect or no effect of vasodilators. Enzymes. In stable and unstable angina, there is no elevation of enzymes, and in NSTEMI and STEMI there will be elevation of enzyme. In echocardiogram, stable angina often normal. In unstable angina and NSTEMI, there may be no ST elevation, maybe ST depression or T-wave inversions. In STEMI, there will be a ST segment elevation. References, and